So I'm going to teach you all to be healthcare professionals. I want you to take your left hand, it's interactive. You're going to take the layer of knuckles that are halfway along your hand and place it in the middle of your throat. Then you're going to turn the fingers into the groove of your throat and you're going to feel your heart rate, your pulse in your neck. You're going to count it for 6 seconds and there's going to be a timer on the big screen. So starting now. Stop. So you now have a number, multiply it by 10. That gives you your heart rate. So some of you will have a 70 or an 80 or a 90. Some of the fit ones amongst you might have a 40 or a 50. Now you're going to do your respiratory rate. Take your left hand again, place it on your chest. You're going to count the number of times you breathe in 15 seconds, starting now. Stop. Multiply that number by 4. You now have your respiratory rate. You're almost a nurse and a doctor. So you now have your own heart rate, your own respiratory rate. You might have a 16, a 20, a 24. You might have a 12. Don't worry if you've got an 8. You're just a bit tired. Vital signs. What we do for you when you come into a hospital, we take your vital signs. We take your heart rate, your respiratory rate. We also do your blood pressure, your temperature, but we thought they might be a little advanced for us to do in a big room like this. I want to talk to you about a new vital sign. A vital sign about compassion, about care. And that vital sign is called what matters to you. I'm going to do that by telling you about Don. Don is in his 70s, and he collapsed at home in Kilmarnock, not far from here on the west coast of Scotland. And he had a life-threatening heart rhythm problem. So he gets admitted to the local hospital, and Victor, his cardiologist, decides with him that he requires a defibrillator inserted into his heart. And that defibrillator will, for the rest of his life, shock his heart back into the correct rhythm, and he'll live a happy and long life. Unfortunately, there's a little bit of a delay for Victor to arrange that defibrillator procedure, and Don decides he wants to leave. So he tries to sign himself out of hospital, and Victor is called, and he goes to see Don. And he sits beside him, and he has a what matters to you conversation. And it turns out that what mattered to Don were his fuchsias. Now, Victor didn't know what a fuchsia was. So he spent some time getting to know Don and hearing from Don about how important his fuchsias were. They were his life. They were what he did. He pruned them, and he watered them, and he looked after them, and he entered competitions with them. They were more important to Don than life itself. So Victor, being slightly more imaginative, thought, let's try and bring the fuchsias to Don, rather than Don to the fuchsias. So that's exactly what he did. They got a van with the pots of Don's fuchsias, and they brought them to the hospital. And Don could go trim, prune, water the fuchsias in the car park of the hospital. They inserted his defibrillator, he did well, he was discharged and went back. You see the difference between the heart rate measurement, the respiratory rate measurement, and the what matters to you. So we have started to spread this around Scotland's hospitals. Jennifer Rogers, who was Nurse of the Year in 2014 in the National Health Service here, started this work in children's hospitals. This is Paige. Paige is 6. When she was admitted to hospital, like all the children in Scotland now, she was given a What Matters to You poster to complete. And this is Paige's What Matters to You. It doesn't include, please give me my chemotherapy on time. That's not what they write. They write, I like it when the nurses are nice and friendly. I like it when my mum and dad get to stay with me. I like it when my ridiculously large Simba Teddy is with me all the time. And strangely for a 6-year-old, Paige also writes, I like it when the teacher comes. Slightly odd. We've also spread it not far from that children's hospital just down the road from here. We've also spread it to some care of the elderly units. And Geraldine Marsh, who's a senior nurse in that unit, started to use it for really confused and cognitively impaired adults. And one of those adults was a lady called Rose. Rose was in her late 80s. She had dementia. She was very confused, very agitated, got up from the bed a lot, fell over. So that's a very complex thing to deal with in a hospital ward. So you put the sides of the bed up, so you trap the patient in. You put a nurse beside the bed so that they have one-to-one nursing. That's a very complex thing to do in a very busy care of the elderly ward. Rose didn't get many visitors. She didn't have many family alive. But one day a niece came to visit. And that niece sat beside her, and one of the nurses had a "what matters to you" conversation with her. And the niece said, well, it's a bit of a surprise that she doesn't have her rosary with her, because that's what matters to her. And they took the rosary out of the drawer, because it had been put in the drawer by the infection control police, keeping the place tidy. And they gave the rosary beads to Rose. And two things happened. The first thing that happened was that Rose calmed down. She didn't get up during the night. They could take the side of the beds down. She wasn't agitated anymore. They could move the nurse who had been one-to-one beside her, and everything was much, much calmer. She was much happier. But the second magic thing that happened was that people started to stop. So we put notices now above the beds where it says, "What matters to me is my rosary beads." And people would stop and sit beside Rose, complete strangers. Other visitors for other families would come and sit and do her rosary with her. She had become a human being. We'd learned something about Rose rather than about the frail, elderly lady with dementia in the bed. So what would my "what matters to me" look like? So this is my 3-week stay in an acute hospital. This is what I would fill in if I put it above my bed. So I would want my family and friends to visit whenever I want, not when they wanted. You see this subtle... You see this subtle difference? Some of them are here, so I should be slightly cautious. I want Wi-Fi available. I want my electronics available. I don't want you to keep anything from me, so I always want to be involved in the conversations. I want to stay connected to work. Oddly, I get more anxious if I'm not connected to this job I do, and maybe a little aspirational for the National Health Service. I'd like a cappuccino for breakfast and an espresso after dinner. So we can't promise everything, but we'll do our very best. So I wonder what your "what matters to you" would be. Could you take a moment, if you're a healthcare worker, a teacher, a social worker, an artist, somebody who works with others, maybe you're an entrepreneur with a company, could you take a moment to ask somebody, a user, a co-worker, somebody who works for you, what matters to them? It's started in health. We're now spreading it to education, to early years environments, other places. And it has begun to spread throughout the world. We now have 10 countries taking part in "what matters to you," from Brazil to Norway to Canada. And in Alaska, they've taken it enormously seriously. The most people-centered healthcare system in the world, would you believe, is in Alaska. It treats the native Alaskans. I had the privilege to visit it in June last year. Now, when I was introduced here, you heard I was Jason Leitch. I was the National Clinical Director of the Health Service, and I had this and that professionally. When you're in Alaska, that's not how you're introduced. You get taught to introduce yourself differently. So in Alaska, I'm Jason. I'm married to Lynn. My sister's called Vanessa. I've got a mum and dad called Jim and Irene, who happen to be in Athens on a cruise today, which is making me slightly jealous. And I like the Boston Red Sox and going to the movies. When I'm at work, I'm the National Clinical Director of the National Health Service. Do you see the difference? Do you know me a little bit more than you knew me before? That's what matters to you is about. It's about compassion and care within our health system and our other systems. Let me take you back to Don. You heard that Don left the hospital, had his defibrillator inserted, did well. Well, the end of the story is that Don entered Scotland's 5-inch pot fuchsia competition. Well, who knew there even was one? And the wonderful news is that Don won it. And if there hadn't been a "what matters to you" conversation with Don, he would probably have died. That's the importance of the What Matters to You conversation. Thank you very much for listening.